Welcome back. A health initiative is bringing medical centers directly to schools in mid-Michigan, especially in more rural areas where health screenings can be more difficult to get. This morning, we welcome Amanda Forsmark to the show, Director of School-Based Programs. She's talking more about this program. Can't ignore the dog in the studio. We'll have that later in the show. But tell us a little bit more about what you do and why it's so important.
Yeah, so school-based health centers in Michigan have been around for about 30 years, but our rural area of Michigan, which is Northern Bay County, Aranet County, Iosco County, Ogama County, kind of have been left out of this. And so we applied for funding right before COVID, received some federal funding, and then everything was on pause, right? And so we just kind of restarted that initiative about a year ago, and we are opening 4 school-based health centers and actually applied for 2 additional sites in our catchment area. And
wow. So who is we though? Tell us who you're with.
We're with, I'm with Sterling Area Health Center. We're a small federally qualified health center that covers the area that I mentioned. So right now we have 5 primary care locations and a dental office in that area. And so we're almost doubling in size with these school-based health centers.
Wow.
In our rural area, our ratio from providers and mental health providers to individuals in need is very high. So we are about 3 times the state average in terms of medical providers to patients, and so we're considered a medical desert. And so bringing these programs, which are comprehensive primary care and behavioral health programs, right to the schools where children and their families can access, is huge.
Well, expand on that a little bit more and explain how this work. Is it a physical clinic, and who can come to them?
Yeah, so we are a physical health center. We're open year-round, not just the school day, and we see children ages 3 to 21. We're a little bit unique to this in regards to the state because we can see families as well. So a lot of these programs around the state only see children and adolescents. We also can see the families and the student or the school district as well.
That has to be making a big impact.
Absolutely, absolutely. So one of our clinics, the nearest primary care site is not within 20 miles of the school. And so to bring those medical services, physicals, well child exams, immunizations, sick visits, laboratory testing, all of that right to children in need is huge.
Yeah, it's way more accessible for not only the students but their families.
Yep.
Does it require parental consent though?
Yes, so any services that we offer, students need to have their parents' consent. Obviously, when they turn 18, they can sign their own consent. And like I said, we're open all school year. The students also don't have to be a member of that school district to access our services. So anybody 3 to 21 can come and see us. So if they're homeschooled or go to parochial schools, they can come see us as well.
Wow, and then quickly before we let you go, where can people find more information, and how do you think this will make a difference long-term for people's health across mid-Michigan?
Well, we know that prevention is key, and especially keeping kids healthy and keeping them in schools. So we know that these reduce truancy rates and absenteeism and all that, and keep kids healthy, keep them in school. We have a flyer on the website, and they can contact me directly. We are still working on our website. Our first 2 clinics are actually opening this spring, and then we'll have 2 more opening soon.
Oh, wonderful. Thank you for sharing your great news today.
Yeah.
Good to see you.
Good to see you too.